Hi, I'm Dr. Carol Lawyer. I'm a veterinary cardiologist and the founder of EchoVet. I thought I'd do a quick video on veterinary ultrasound using EchoVet. So, as a guide to just show everybody what veterinary ultrasound is and the different parts of veterinary ultrasound as it's grown up through decades now. So, here is EchoVet. And so the big scene of veterinary ultrasound is there's fast and point of care ultrasound, just basic ultrasound, both abdominal and thoracic, and then full abdominal and full thoracic. Those are the big sections of veterinary ultrasound. If we go to fast really is trauma based. Is where it is in human medicine and kind of where we're making it in veterinary medicine. And really, it's about effusions. Does some animal with trauma have effusions? So effusions in their abdomen, in their pleural space, their pericardial space, and it also includes pneumothorax, which is a little bit harder to evaluate. And you do that on both an initial exam and a serial to evaluate what these effusions do. So it's effusions and it's trauma-based. POCUS and PLUS, this is point of care ultrasound, and PLUS is pulmonary and lung ultrasound. These are question-based. These are for an animal that comes in that isn't feeling very good, and you want to answer questions about it. It's not meant to be a full ultrasound, but it is meant to be quick, and it's meant to be able to be done on every animal that comes in that's sick into your practice to answer basic questions. It's a question and answer based system. So, does it have abdominal effusion, just like the FAST exam, both initially and serially, but mostly initially? Does it have pneumoperitoneum? Can you assess urine production? Is there a gallbladder halo sign, a sign of anaphylaxis? And in cats, do they have renal pelvic dilation? These are questions that are answered in a point of care ultrasound, and that's in the abdomen. You also have the thorax as well. In the thorax, you have pulmonary and lung ultrasound, and so it's the same thing. Is there effusions? Is there pneumothorax? Is there signs of pulmonary edema, whether it's cardiogenic or non-cardiogenic? And are there any masses that you can see as a subpleural lesion? So this is the same thing as in the abdomen. And then there's a point of care for the thorax as well. And this is there pericardial effusion? What is contractility? And there's quick measurements to be able to assess contractility in a patient. Are they volume underloaded or not? Again, a quick measurement-based system, or you can do it subjectively. And then what is left atrial size? Is there signs that there might be cardiac involvement or not? This is all answered under the cardiac point of care. This is all designed to be question-oriented and very quick. It's not a complete exam at all. And then we now move on to a basic ultrasound. This is where you take a basic course, and you'll learn in the abdomen, you'll learn kind of the 5 major organs, liver, gallbladder, spleen, bladder, and the 2 kidneys. These are the normal things one would learn, and then you'll just be able to put in general assessments about those different systems. This is a basic abdominal ultrasound. Again, can be done as a screening tool. You don't have to be a specialist to do this. Just some basic ultrasound training. And now we're going to move to the thorax. So we went in the abdomen, and there's the big 5, they call it. And now in the thorax, you take a basic ultrasound course, and you'd learn how to do these basic measurements. This is of the left ventricle. Here's left atrium, aorta. And these are very basic measurements that you would learn in any basic course. And then you go on to, what did you find? What are you finding when you look at the heart? And these are basic things that you would be taught in a basic course on thoracic ultrasound. Again, not specialty derived. People with basic training can do this kind of basic thing. And then are there effusions? And you're going to would describe effusions or masses. Are there thrombi in the heart at all? And then are there hepatic venous distension, that kind of thing in the abdomen? Is it cardiac related? Then in a basic course and an intermediate course, certainly, it's pretty easy to turn on color Doppler and learn something about regurgitation jets and is outflow turbulent or not. And then there's very, very little to know in M mode that you have to know in M mode. But this is just a basic ultrasound. And then in veterinary medicine, we move on to a complete abdominal exam. This can be with a radiologist, an internist, or somebody with advanced training and quite a bit of practice doing abdominal ultrasound. And here's all the things that you would look at. Liver and gallbladder, spleen, urinary tract, gastrointestinal tract now, adrenals, pancreas, and reproductive tract. This is a full exam, and we've got everything you can look at. If it exists, we've got it. I mean, of course, that's not totally true. There are always things to find that we could not be able to describe. And we've got a lot of things we can look at. And this is more on a specialty level. A radiologist would do all this, or an internist would do all this, or again, somebody with advanced skills. And in the thorax, this is where I live. I'm a cardiologist. I live here all day, every day. So there's a lot of things one can measure. So measure in M mode, and then these are all the things there are things to measure in M mode that I do all the time. So many of these things, I wouldn't do all these on every patient, but I'll use them. I use virtually all of it. And then there's two-dimensional measurements of a bunch of things as well. And then spectral Doppler, I've simplified it out. And then there's details under any of these with even more things that one can measure that are useful. So not in every patient. And then there's tissue Doppler as well. This is for somebody, a cardiologist, or somebody that really is starting to do hearts and is comfortable in the chest. And then you have to say, well, what does all those measurements mean? And then there's a lot of findings one can do, just the regular cardiac. I've set it up so that I just set findings from the measurements, and it'll auto-analyze. Well, if I can measure it, it will analyze it pretty much. And then we've got Doppler, color Doppler findings for the amount of regurgitation or outflow, M mode, spectral. And then here in veterinary medicine, we don't do this I do it a lot, but it's been a bit difficult to do segmental wall analysis, which they do in people all the time. And so we can now bring that into veterinary medicine and be able to do a complete thing. This is primarily in cats. And with spectral Doppler, we can analyze. These are kind of the big things that we really want to know about, and all that's present. And then really, charting this over time. I do charts all the time on my repeat clients, repeat patients. Shows value for what I do. Shows why I want to bring that patient back and take a look at him again. So that's veterinary ultrasound, and from fast and point of care all the way to advanced thoracic ultrasound. So thank you. Thanks for watching. Please sign up to EchoVet.com. Hit subscribe to help us get the word out. Give us a thumbs up, and we can get the word out to other veterinarians and other sonographers. Thanks a lot.